Hello, my name is Amy Lucero, and I'm a student at National University in class MSW 6008. This is my signature assignment. It is titled Assemble an Interdisciplinary Therapeutic Team to Deliver Services to an Identified Diverse Population. I chose to do scenario 1, where client is an 84-year-old African American woman who lives on her own in a subsidized housing building. Her husband of 58 years recently passed away. The client requires medication management and assistance of her ADLs. The client has Medicare coverage and receives Social Security. The client has some financial burdens of medical debt and monthly costs and bills. The client demonstrates symptoms of depression. The client has limited knowledge of community resources. Who is the multidisciplinary team? In order to support the 84-year-old client effectively, a multidisciplinary therapeutic team should address her medical, emotional, and social needs in order to promote her independence and well-being. When supporting geriatric clients, it is important to consider their quality of life. Quality of life for older patients encompasses a broader spectrum of factors, including physical health, psychological well-being, independence, social connections, personal beliefs, and their interaction with the environment. The first professional in the multidisciplinary team is the primary care physician. The PCP oversees her overall health, manages chronic conditions, and coordinates with specialists. The primary care physician provides the client with regular health checkups and prescribes and adjusts any and all medications as needed. The geriatric psychiatrist or psychologist addresses her depression and mental health needs. The geriatric psychiatrist or psychologist evaluates and treats the client for depression. They also provide therapy or counseling and coordinate the client's medication management of antidepressants with the primary care physician. The home health nurse provides medication management and ensures she follows her prescribed treatment plan. The home health nurse provides medication management and ensures that the client is following her prescribed treatment plan. The home health nurse also assists with the setup of the medication, organizes and monitors the client's physical and emotional health at every nurse home visit. The personal care aide provides hands-on assistance with daily living activities. The personal care aide helps with hands-on assistance with daily living activities or ADLs, such as bathing, dressing, meal preparation, and light housekeeping. The personal aide may also provide companionship and help to reduce the client's social isolation. Occupational therapist assists with her ability to perform daily living activities independently. The occupational therapist evaluates the client's living environment for safety and recommends any safety and/or assistive devices that the client may need in the home. The occupational specialist also provides the client with strategies to maintain their independence in their daily activities such as cooking, dressing, and bathing. The social worker connects the client to community resources and addresses her financial housing, and social challenges. The social worker assists with Medicare benefits and navigating the client medical debt. The social worker also links the client to community resources such as meal delivery programs, transportation, and local senior centers. Palliative care social workers assist with assessments, counseling, and liaison with local resources and agencies, and training and development activities, staff support, and clarification of healthcare wishes and values. Community Resource Coordinator. The Community Resource Coordinator increases her knowledge of and access to local resources for seniors. The Community Resource Coordinator may introduce the client to senior programs or organizations in the community or faith-based community services. The Community Resource Coordinator may also arrange for transportation for medical appointments and social events in the community. The grief counselor or chaplain supports the client through the grieving process. The grief counselor or chaplain provides emotional and spiritual guidance and helps the client find her meaning and purpose after her loss. The grief counselor and chaplain also provides emotional support and counseling. The physical therapist improves the client's mobility and physical health if she has mobility issues. The physical therapist provides the client with a personalized exercise plan in order to enhance their balance and strength in order to prevent falls and improve mobility. The team coordinator provides case management to ensure a holistic approach and ensure the engagement of family or friends or social supports. The team coordinator or case manager works with the entire multidisciplinary team in order to ensure that the team is collaborating and is providing a client-centered approach while engaging the client's social supports. Family and friends. Case management interventions delivered in community settings are led by a health or social care professional, supported by a multidisciplinary team, and focus on the planning, provision, and coordination of care to meet the needs of the individual. The three primary goals of care coordination. The first goal is to manage depression and address grief. The second goal is to enhance medication management and daily living activities. And the third goal is to connect to community resources. Care coordination from a multidisciplinary team decreases the incidence of morbidity. Coordinated care is broadly considered as teamwork across a range of different healthcare professionals, while patient-centered care focuses on involving patients in their own care. In this scenario, the client is receiving patient-centered care so that her individual goals of independently living are being met. So for the first goal, I have chosen to manage depression and address grief. Objective is to reduce symptoms of depression and provide emotional support during the grieving process in order to be able to build rapport with the client so that services may begin. The team member supporting the client in goal number 1 is the geriatric psychiatrist or psychologist in order to provide mental health care. They would provide assessments to diagnose depression and establish any necessary treatments, provide any counseling or therapy, and prescribe any medication therapy. It is estimated that around 10 to 20% of older adults worldwide live with depression. In older adults, depression symptoms are similar to other chronic health conditions, and mood changes are less prevalent and commonly replaced by physical discomfort, resulting in challenging diagnosis and subsequent delay of treatment access. In addition, the grief counselor or chaplain may provide emotional support and spiritual well being. They may provide one on one grief counseling and encourage participation in the bereavement groups for peer support. The social worker addresses social and emotional barriers and helps to identify and connect the client to community grief support groups and arranges for regular check ins to ensure that emotional needs are being addressed. For goal number 2, I have chosen to enhance medication management and daily living activities. The objective is to ensure adherence to prescribed medication and support independence in activities of ADLs. In goal number 2, the goal is to monitor the medication management, the medication refills, and this is supported by the home health nurse. The home health nurse also tracks for any missed medications and adverse medication symptoms. The other objective of this goal is to monitor and support the improvement of the client's ADLs. Both the physical therapist and the occupational therapist may assess a pre and post assessment of the client's ADLs to observe for the client's abilities to perform tasks such as dressing, grooming, and meal preparation. Lastly, the occupational therapist and the social worker may assess for environmental safety in her living space, both before and after modifications. For example, installation of grab bars in the restroom and the use of assistive devices in the home, such as walkers. For goal number 3, I have chosen to connect to community resources to maintain independence. The objective is to increase the use of community services, reduce financial stress, and increase social engagement. In goal number 3, there is more work with the social worker, the case manager, and the personal care aide. The goal is to track the enrollment and participation in programs such as Meals on Wheels, senior centers, and transportation services regarding the client's engagement. It is also a goal to reduce the client's financial stress by assisting the client in enrolling her in utility assistance programs and providing her assistance with reaching out to medical debt collectors. Lastly, it is important to monitor the client's participation in social events or activities provided by senior centers and other nearby community organizations in order to reduce the client's isolation and her sense of social connectedness. Methods of evaluation include regular team meetings, client feedback, outcome data analysis, and care plan reassessments. Evaluating a team effectiveness with a client's participation can be done in various ways. Holding bi-weekly meetings with the multidisciplinary team in order to discuss adjustments to interventions as needed. Gathering client feedback and informal interviews to capture the client's perspective based on the support that they're receiving. Comparing pre and post intervention assessments for depression, ADLs, and financial or social metrics. Finally, the client's care plan based on their progress and emerging needs while ensuring that their goals of living independently and improving their quality of life are still being met. Therefore, by combining these methods, the team can determine its effectiveness and make data-driven decisions to improve the client's care. These are my references. Thank you.